Tra le righe della mente è un invito ad esplorare insieme il panorama ricco e complesso della psicologia cognitivo-comportamentale contemporanea. Autori o curatori dell'edizione italiana di nuove pubblicazioni vengono intervistati da chi quegli strumenti li utilizza ogni giorno nel proprio lavoro. In ogni episodio puoi scoprire un manuale, una guida self-help, un materiale operativo. Cosa contiene? Da quali esperienze è nato? E in che modo potrebbe fare la differenza per te? Anche i libri di psicologia raccontano delle storie, quelle delle persone che li hanno creati e delle persone a cui sono destinati. In questo podcast proveremo a farle emergere, leggendo tra le righe della mente. Che tu voglia orientarti tra le novità editoriali o approfondire un tema che ti interessa, qui trovi un confronto concreto, pensato da professionisti per colleghi e clienti, disponibili in audio e video. Tra le righe della mente è un'iniziativa di Centro Interazioni Umane, un progetto di IESCUM che, online e a Milano, offre psicoterapia, consulenza e formazione basate sulla psicologia cognitivo-comportamentale contestualista, l'Acceptance and Commitment Therapy e la mindfulness. Per restare in contatto, visita il sito www.centrointerazioniumane.it e seguici su Instagram, Facebook e LinkedIn.
Welcome. I'm really glad to have you with us this evening. I am Nanni Presti. I am professor at the University of Vienna. And the person that you see close to me is Russ Harris. And thank you, Russ, for joining us today.
Thank you for inviting me.
Russ is a physician, he's a psychotherapist, and one of the most international renowned ACT trainer.
Famous person.
Very famous person. And I can say he's also a successful writer, because in Italy you have sold more copies than a usual novel artist. So,
That's exciting.
Yes, more than 100,000 copies of The Happiness Trap.
And you helped translate that, didn't you?
Yes, I translated it. So you owe me something. So
I'll buy you a grappa later.
Okay, let's go for the grappa. Russ is in Milan for a 2 days workshop organized by IESCUM on ACT for depression, self-harm, and suicidality.
Yeah.
But we also want to talk this evening about the book you recently published in Italian with Erickson in 2024 on trauma-focused ACT.
Yeah.
But before going to that, I would like to get a chance to interview on your experience, your travel, your voyage in ACT, maybe starting from the beginning. How do you happen to meet ACT? Where did you find ACT? Under the bed or?
Well, we have to go back a long way. I was struggling with anxiety as a teenager, as a medical student. I grew up in England. I went to medical school in England. As a medical student, I had very high anxiety. But I just dealt with it really through drinking, which is good. It's easy to do as a student, and then after I graduated as a doctor, I worked in England for a while, and then I emigrated to Australia. And then I got very depressed, and I couldn't really understand it because, I had this great profession. I'm a doctor. I moved to Melbourne, which is one of the most exciting cities in the world. Australia, great weather. I had all the things that you're supposed to have to be successful. And I was just miserable. And the main way that I was dealing with it, I'd moved off drinking, and what I was mostly doing was eating. And so I was eating lots and lots of food to push my feelings away. I was working as a family doctor, And there's a type of chocolate biscuit in Australia called Tim Tams, a very nice chocolate biscuit. And I would have like packets of these in my drawer. And in between, in between each patient, I would pull out the Tim Tams and eat them. And I was much, much bigger than I am today, maybe 30 kilograms heavier than I am today. And I had high blood pressure, and I was only in my 20s, and I was miserable, you know. And so I started reading self-help books to try and understand what was wrong, you know. And the first books I read were on CBT, traditional CBT, and that got me very interested in therapy. And I went and had some therapy myself, and I thought, I would like to do this rather than be a doctor. And so over the space of several years, I started training as a therapist, and I started reducing the amount of patients that I was seeing as a doctor and starting to put aside one day a week to do therapy with clients, CBT. And that became 2 days, and that became 3 days, and that became 4 days. And then eventually that was my full, I said goodbye to being a medical doctor and became a full-time therapist. And my income went zhoof. Much more money as a doctor than as a therapist. But my satisfaction went up. I enjoyed therapy much more than I was very interested in this, and not so much interested in prescribing drugs and the physical side of medicine.
And when actors sneaked in your life, I mean, in this therapy life,
Yeah.
new life?
Well, you know, having trained in CBT, there were lots of things in CBT that I liked, but there were other things that didn't work that well for me, you know, like the challenging disputing thoughts never actually really worked that well for me. So I always felt like a little bit of a hypocrite or an imposter. And so I started to get very interested in mindfulness as an alternative, and I discovered the work of John Kabat-Zinn, mindfulness-based stress reduction, and that was very interesting to me. And then I also discovered Viktor Frankl's work on logotherapy and meaning and purpose. And so I was trying to put these things together and make them work. And then a friend of mine said, you need acceptance and commitment therapy. And I'd never heard of it. So I went to the bookstore, and there was one book, just the original 1999 textbook. And I bought it and took it home. And I just stayed up all night reading it. It was like, oh my God, this is amazing.
Revelation.
It was incredible, you know.
You got the book.
Yeah.
You say, this is... and there is something that I really envy among the different skills that you have that I envy. There is a specific skill that I always find really interesting, because that book and many others ACT book are kind of difficult to chew, to go into. But if you read The Happiness Trap, it's something that that's for me, I mean, for the common reader. And you have this skill to present ACT and to introduce ACT at the trainer level or at the patient level in a way that it's very, very simple.
Oh, thank you.
How did you get to that point? And where those languaging come from?
Well,
What's your secret?
And I love its title in Italian, La Trappola della Felicità. It's so good. Do you know, when I was at school, and at medical school in particular, I had a lot of trouble learning, really. At school, I was able to kind of just force my way through, but once I got to university, attending all those lectures, trying to memorize everything, my grades flopped. My first 2 years at university, I failed every exam. I spent all my holidays studying to resit the exams, and then eventually, you know, I got through. And what I realized was that I just can't pay attention if there's people that are lecturing using big words, long language, convoluted sentences, I just drift off.
Okay.
ADHD, that's
Yeah.
me, but I didn't know that at the time. I just thought I was stupid. And what happened was I just stopped going to lectures. I realized that if I read it in the book, I could teach myself from the book better than going to the lecture and having someone talk to me. And it basically gave me, loathing's the wrong word, but I just don't like complex, long structures, sentences, waffle technical jargon. I find it very hard to learn that way. So basically, to get through medical school, I had to simplify everything and put everything into simple language so that I could learn it. And then as a doctor, I took great pleasure in simplifying things so that my patients could understand them. And I guess it came from there, really. It was just for me, like, how do I understand this, So it transferred across to other people.
Well, so many people benefited from this hard way of learning. Yes. to explain things. And from your perspective now, going back to this time when you started reading and learning ACT, practicing ACT in the very first forms of ACT, and then deepening into it, and then publishing stuff. So if you go back and see the whole evolution of your personal approach to ACT, and also the evolution that ACT has taken in these 25, 30 years, what is your feeling of that temporal development?
Yeah.
What is your...
Well, I feel like ACT has become very diverse as many voices have come into it. Like, 20 years ago, it was all based on the original textbook, and there were metaphors that everyone used, and there were exercises that everyone used, and it was all very, very similar. But over the last 20 years, so many people have come in with new metaphors and new exercises and new ways of working. And it's really exciting to see that diversity, So you can still find the old school ACT, but you can see so many new ways of doing it. And I think particularly the emphasis on self-compassion, it was always there in the model, but it was a little bit in the background, whereas what we've seen in the last 15 years is, self-compassion has really come forwards, it's center stage, it's such an important part of the work. And I think, really the flexibility with mindfulness processes, there's so much more now about simple, easy ways to build it into your life. A term I like a lot is mindfulness on the go. How can you just do mindfulness on the go without having to sit and meditate? What are some simple, quick, easy ways to build it into your daily routine?
So going to your last book published in Italy, Trauma-Focused ACT, what was the urge? What drove you
to write that book? Well, there were quite a few reasons, but the biggest reason was because in the writings on ACT for Trauma, no one had really talked about how to do formal exposure to traumatic memories. So ACT is an exposure-based approach. You're doing informal exposure in ACT all the time, but it's a very, very important part of working with trauma that some clients don't need it, but some clients really do. They need this formal exposure to traumatic memories, and it wasn't really in ACT. So people were going outside ACT to EMDR or prolonged exposure. And I was like, well, that's okay, but we actually have our own exposure processes in ACT, and these were outlined very clearly by John Forsyth and Georg Eifert. Back in 2004, they produced a textbook, ACT for Anxiety Disorders, which really went step by step, how do we do exposure in a formal way? And so for years I've been using that in my work with trauma and finding it very effective. So I wanted to write a textbook showing how to incorporate that formal exposure. But also, I mean, there are so many different ways of doing ACT work. I kind of wanted to show other ways of working with trauma. So, just so that there's diversity.
And when we write books, I'm an author, but also when I translate books and I translated your books, there's kind of a special relation with that kind of words, the book, the matter. What was your relation with this book? Your personal relation?
With the actual words?
Yeah, with the words, with the material you were putting down.
I think for me, this book, in part, it came out of I think my career highlight was back in 2015, the World Health Organization asked me to write a ACT protocol for use in refugee camps. Well, there's now been, that's a 10-hour protocol, and it's run 2 hours a week in refugee camps in groups. And I was actually quite anxious writing it. This is not going to work. These people have got multiple traumas. They're living in refugee camps. It's a protocol that's going to be run by volunteers, not health professionals. It's going to be done with audio recordings, 2 hours a week for 5 weeks. It's never going to work. So I was like, this is the end of my career now. Everyone's going to think I'm rubbish. And then the results came in, and it was astonishing that, significant drops in PTSD and depression. And so, it was that experience also that kind of led to writing the book, because so much of that work is just giving people really simple, practical ways to deal with trauma.
And in the book, you work across 3 areas: the present, the past, and the future.
Yeah.
And how does ACT moves across all these 3 dimensions?
Well, fluidly and flexibly. But yeah, I mean, probably the bulk of the therapy is in the present moment. How do I get into my life here and now? How do I focus on what's important? How do I engage in what I'm doing? How do I unhook from difficult thoughts and memories that are showing up? How do I make room for difficult emotions and feelings showing up? So the bulk of the work is in the present, but at times we do need to go back into the past, exposure to traumatic memories from the past. If people have had really difficult childhoods, we might do inner child imagery, kind of imaginary exercises where they go back and they comfort the child and look after the child, and that often can be very healing for people and help them tap into self-compassion and, do healthy grieving processes and so forth. And at times, certainly towards the end of therapy, we really want to move into the future when therapy is over. What are your medium-term goals? What are your long-term goals? Where do you want to go in your life? There's the concept of post-traumatic growth, that people can actually grow through their trauma. That's what we're aiming for, not just recovery and resilience, but actually grow for this. And this is where the values work is
flourishing.
Yeah, exactly.
And EMDR is one of the world recognized standard in trauma. How do you compare ACT to EMDR, and if they can be somewhat integrated or not?
It's an interesting question.
I know. Because I don't want to put you in a difficult position, but it's something that people could ask you.
I think what we can certainly say that EMDR works. It's very effective. We can say that. The controversy is, how does it work? So people that are EMDR fans think it works through these, various neurological processes, but people outside of EMDR think it works through exposure. And that's what I think. But that's just me, you know.
Yeah. And about exposure, what about compassionate exposure that you introduce?
Yeah, so, you know, it's kind of, again, Forsyth and Eifert 20 years ago were very big on the idea that this is compassionate, flexible exposure. So it's not toughing it out, it's not just forcing yourself. It's recognizing that exposure is hard work and it's painful and it's anxiety provoking. And can I be there in a kind, supportive, caring way for myself as I do this work? And that makes a big difference.
And exposure can be difficult for the therapist too.
Yeah, well,
and you underline on the book.
Yeah, there's good research on this that a lot of therapists avoid exposure, even though logically and rationally they know that it's needed, but they won't do it because it brings up discomfort for the therapist.
So discomfort could be one trap for the therapist in the session.
Yeah.
Are there any other traps for therapists?
Well, that's definitely the biggest one, and that's why ACT, you know, one of the strengths of ACT is that you learn it by doing it on yourself, so that when your own anxiety shows up, if you're doing exposure, you can make room for that and focus on what you need to do. Other traps, I guess, either, you know, therapists confuse with their own hopelessness. You know, often trauma clients have got multiple problems in multiple areas of life. The therapist fuses with, oh no, it's too much, it's too hard, I can't do anything. And so, you know, in the same way that we encourage clients to focus on their locus of control, what's in your control, therapists also need to do the same. You're not trying to fix all their problems all at once. What can you do in this session? And, you know, one of the great things about ACT is because it's a process-based approach, if you teach a simple diffusion skill, that can be used for so many problems.
So in this setting, how does acceptance work? I mean, why, as a traumatized person, I need to accept? Or what I need to accept?
Well, you know, I would never use the word acceptance with clients because they almost never understand what we mean by it. So the term that I use is taking the power out of difficult feelings, learning how to let those feelings flow through you without jerking you around or pulling you down, or, you know, I use the ACT terms of hooked. You know, you get hooked by your emotions, they jerk you around like a fish on a line, you know, or a puppet on a string. So would it be interesting in learning how to unhook from those emotions? Another term I use a lot is take the power out of them. Would you be interested in learning how to take the power out of these emotions so they can't keep controlling you? So when you present it that way, it's very different.
But also acceptance and welcoming somehow your body sensation, your feelings, your emotions. So body could be a central part also in ACT. How do you feel about that?
I think this kind of trauma-focused ACT is a lot more bottom-up, working with the body, sensation, feeling, physical movement. A lot of ACT is quite top-down. It's very cognitive. There's a lot of emphasis on, you know, cognitive diffusion and values, all of which is important. But with trauma, you need a much more of a bottom-up emphasis in the work. So helping people to tune into their bodies, and if clients are, you know, dissociative, cut off from their feelings, that work can be very challenging.
And sometimes, I mean, therapist and client can be in a situation where they both feel stuck. They don't. Don't feel they're going somewhere.
That's true, and that's and the single most common problem I encounter in supervision is that there are no clear therapy goals. Anytime that client or therapist is stuck, you know, you need to come back to what are our aims here, what are we working towards, what are our goals, and without that, who knows how can you even tell if therapy is making any difference if you don't have some goals that you're working towards?
And going towards the end of therapy and the end of the interview, I'm taking something that you told before, that is ACTA is about thriving, flourishing. So what has ACT on how ACT has contributed to your life in flourishing and thriving, or
Yeah.
or in
Well,
happiness?
I mean, enormously. You know, I look back on my 20s and I'm still have a lot of anxiety, but it most of the time it doesn't control me. You know, most of the time I can use ACT on myself. There's always room for improvement. There's times I forget everything I've written, everything that I've done in that, but a lot of the time I'm able to use ACT in my life, and I'm, you know, much happier and healthier, you know, than I was 40 years ago. So that's pretty cool, you know.
So it works both for the therapist
Yeah.
and the client, or client and therapist.
It does. And when I'm in session working with clients, I'm working on myself at the same time. You know, we'll both sit with our feelings. We'll both kind of practice a self-compassion exercise. We'll both do some dropping anchor together. You know, so
it happens to me too. Whenever I do therapy with clients, I'm part of that flourishing process, and it's really, to me, it's really reinforcing. Even if we are diving into very difficult emotional or life events.
Yeah, exactly.
So, takeaway message.
Takeaway message.
What if the reader wants to have a single message from you, from your book?
Okay.
What could it be?
Well, throughout the day, whenever you have the opportunity, ask yourself 3 questions. Am I present? Am I open? Am I doing what matters?
Okay. And so let's bring our mind in the future to close this conversation.
Okay.
You told me about the 3rd edition of your manual. Can we have a little sneak peek at it? Just to create a bridge for the next interview on that book.
Well, probably one of the biggest differences in the 3rd edition is that there are sections for neurodivergent clients and how we adapt and modify, you know. So I think that, you know, the first 2 editions are actually, you know, because they are written in quite a simple and accessible way, actually do work very well with neurodivergent clients, but there are also tweaks that we can make.
Sure.
That's probably the biggest shift.
Yeah, I'm looking forward to it and to this new conversation.
Lovely.
So thank you very much for this conversation, very rich and concrete.
Thank you.
E adesso vorrei dare alcune informazioni per il libro. Potete visitare il sito dell'editore di Erickson, sentire il nostro podcast e avere uno sconto Autori 26. Per chi è interessato ai training IMDR può consultare il sito Interazioni Umane, anche qui con righe 01 potete ricevere uno sconto.